Plasma cell leukemia is a very aggressive disease that is characterized by the presence of more than 20% plasma cells in the peripheral blood. And it's a disease that has some differences from myeloma, despite the neoplastic cell is a plasma cell, because it must more commonly occur in patients younger than patients with myeloma. There is about a 10 years median age difference. It is more frequently a highly aggressive disease with more frequently extramedullary disease, in particular in the liver, in the spleen, but also in the lymph node. Generally more often the cytopenia, in particular thrombocytopenia and anemia. And more frequently there are high-risk chromosomal abnormalities, such as, for example, deletion 17p. The survival of patients with plasma cell leukemia increased in recent years, but we still are suboptimal. In terms of treatment, there is still an early mortality rate, even in the era of novel agents, that is related both to the aggressiveness of the disease and to the occurrence of complications and, in particular, infection. Whenever a patient is eligible for transplant, the standard option is first an induction with novel agent-based therapy, and then autotransplant, potentially double autotransplant, and then consolidation and maintenance. And in some patients, maybe an allotransplant could be considered based on the age, based on the risk, and so on, even if the data so far on the use of allotransplant did not show any overall survival benefit over the autotransplant. For the elderly patient, the treatment is more tricky because they are less likely to tolerate intensive regimens. So generally the approach is, if the treatment can be tolerated, the use of multi-agent chemo with, for example, combination of PI plus immunomodulatory agents and a continuous therapy approach. And it's fundamental for all patients, the supportive care in terms of tumor lysis prophylaxis, thrombosis prophylaxis, and in particular in terms of infections management and prevention with antiviral, antibacterial, and antifungal therapy.